Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hello, my name is Dr. Greg Poland. I'm a professor of medicine and infectious diseases and director of the Mayo Vaccine Research Group at the Mayo Clinic in Rochester, Minnesota. Welcome to this podcast episode entitled COVID-19 Boosters and Variants, Answering Your Questions. This is part of a 6-episode podcast series called What to Know About COVID-19, the Flu, and RSV. Today, I'm talking with Dr. L.J. Tan. Dr. Tan, tell us a bit about yourself and your work.
Thank you for having me here today. I am L.J. Tan, and I am the Chief Policy and Partnerships Officer at Immunize.org. Immunize.org is an organization, it's nonprofit, and we predominantly do work in terms of educating the healthcare providers that give vaccines, as well as the public who receives their vaccines. So delighted to be here to chat with you, Greg. It's always fun.
And good to be with you. And today we're going to be talking about COVID-19, vaccines, and booster shots. And we're also going to discuss COVID-19 variants and how that relates to the vaccines and booster recommendation. But just to kick things off, perhaps it would be helpful just to remind everyone a little bit about COVID-19 and the effects it can have on your body. So let me give a brief refresher. COVID-19 is a respiratory viral infection, which is a general term that we use for an infection in your respiratory, that is your breathing system, that's caused by a virus. And it's important to know that while some of these infections can stay in the respiratory tract, there are others that can start there and then move or affect other parts of your body, like COVID-19. So with COVID-19, the virus that causes the infection can go on to damage many different organs and systems throughout your body. So LJ, let's talk a bit about what viruses actually are and what they do.
Yeah, thank you, Greg. Viruses are very small organisms. And in fact, you can't see them with the naked eye, and they're everywhere. They have genes. And their genes are either made out of two different types of genetic material, either DNA, and then they can have genes that are made out of RNA. And so these genes are protected by a protein that surrounds them. Viruses cannot reproduce themselves until they're inside one of your cells, inside what we like to call a host cell. So you're the host and you're providing a cell for them to infect where they will then reproduce. And that's when the damage happens. When they reproduce inside your cells, they can damage and kill your cells. That will actually then cause the bad effects that come out of the infection.
Yeah, LJ, perfect. And it's exactly that damage that can be a real problem because the virus that causes COVID-19, as we've mentioned, can do this throughout your body, not just in the respiratory tract. And so we're seeing that COVID-19 can lead to a variety of symptoms and complications or additional problems that can be long-lasting and significantly degrade the quality of someone's life. So it's important to remember that COVID-19 is mainly spread through the air. When somebody who is infected talks or coughs, sings, sneezes, so anyone at any age can get infected with the virus. Now, many people, once they do become infected, may have no symptoms or just mild illness. But for some, COVID-19 can be severe and even deadly. And this can include both children and adults who have chronic health conditions, as well as people who are pregnant and smoke. Also, if you're age 50 or older or haven't been fully vaccinated, you're also more likely to get very sick.
That's right, Greg. I think one of the things I think we want to also bring up here at this point for the audience is we also now know that there are post-COVID conditions. That means these are things that happen after you catch COVID, right? So something that we're calling now long COVID. And I'm sure many of the listeners here have already heard about this and read about this. And that long COVID can develop in anybody, regardless of your age. And this long COVID is this range of new, returning, or ongoing health problems that you can have for weeks, months, and for some people, even potentially years. And we've been hearing people from the early infection days still suffering from some of these after effects of long COVID. And one of the things we do know is that they tend to happen more in people who've had severe illness. But the data is also beginning to show us that anybody who gets infected with COVID can have the risk of long COVID. And this also includes people like you've mentioned who only had mild illness, Greg, or have no symptoms whatsoever. And then even some people who didn't test positive initially or know that they were infected in the first place could have ended up being infected and end up getting long COVID as well. But the problem with long COVID is while we can test for what we like to call acute infection, which means you got infected 5 days ago, we can now test and know that you've got COVID. We don't have a test that can say you've got long COVID. We've got to look at those symptoms. And sometimes it's a heart symptom. Sometimes it's a neurological symptom, right? Neurological being of the brain. Therefore, to diagnose long COVID requires clinical diagnosis and time from how long you've had those symptoms. But I think here's the point. If you aren't vaccinated against COVID-19 and you get infected, it is becoming clear that you might also be at higher risk for long COVID compared to if you were vaccinated and ended up getting some kind of breakthrough infection.
A reminder, too, that when it comes to the symptoms of current COVID-19 infection, they can be tough to distinguish because they can be very similar to the symptoms for multiple other respiratory viral infections, including influenza, or what we tend to call the flu. So you can't use symptoms to rule one infection in and the other one out, or to help determine which infection you might have. For example, some of these similar or overlapping symptoms include coughs, sore throat, runny or stuffy nose, feeling feverish or actually having a fever, muscle pain and body aches, and also more general symptoms like headache and fatigue or tiredness. So when you do have symptoms that are upper respiratory in nature, you want to contact your doctor or healthcare team member as quickly as possible to protect your health, your family's health, and your community. If you have respiratory symptoms, even very mild ones, there is testing that can be done to find out which virus is causing illness. And knowing that can be important because you want to make sure that you're taking steps to protect yourself and others. So LJ, talk a little bit about how vaccines work.
So I think it's important to remind all of us that vaccines have been used for hundreds of years now to help protect us against many, many deadly diseases. In fact, the first vaccine against smallpox, as we all know, eradicated smallpox from this planet. And we continue to vaccinate against polio, tetanus, influenza, and the benefits of those vaccinations continue to be very clear. So what does vaccines for COVID-19 do? Well, basically, when you get vaccinated against COVID-19, what we're doing is we're introducing a way for the immune system, what I like to call the army of cells that patrol inside your body and keep you healthy, a way that they can recognize the enemy. And then when we see COVID-19, we can react much faster. We're ready to go. It's kind of like a memory response. Your immune system goes, hey, I fought this as a vaccine. When I'm seeing it now, because I'm actually getting infected, I'm ready to go fight better. So that's what vaccines try to do. And so one of the tools that your army of immune system cells uses is something called antibodies. And I think many of you have heard about these antibodies now. When you get exposed to an infection, your immune system makes these antibodies and they release them into your blood and they float around in your bloodstream. And when they see the enemy, in this case, COVID-19, they bind the COVID-19 and they take it out of commission, right? So very simply put. However, it does take time for those antibodies to respond. And that's why we do the vaccines. Using a vaccine, we, again, as I said, have biased the battle in favor of your immune system so that they actually can win that fight. And then when they actually see COVID-19 for real through an infection, they're able to respond. So that's how immunity or protection against the future infection of COVID-19 is done with vaccines without you actually getting sick. And this is really safe because we're controlling the situation and we actually don't use the real virus itself. But the way we do it is such that you cannot catch COVID-19 from a COVID-19 vaccine. And I think that's important to emphasize over and over again. And then one of the things I want to keep in mind is that you hear a lot about people saying, hey, I'm young, I'm healthy, I'm not worried about COVID-19. Well, I think what is real is that even if you're young and healthy, there is no way of knowing how your body is going to react to getting COVID-19. And so what we're offering with the vaccine is a controlled fashion in a safe way so that when you actually get infected, you're able to fight that disease in a much more better way. So why are we gambling? We have a safe, effective vaccine that prepares your body, and we don't know what COVID-19 is going to do to you if you catch it. So why don't you want the safe way out? And if you get COVID-19, you run this risk of severe illness, these complications, the long COVID we just talked about. So all of that is something we want to avoid. And the vaccine does that. It prepares you and it helps you avoid those risks of severe hospitalizations, the risk of death, the risk of complications like long COVID.
I can't stress that enough, LJ. That's exactly right. Getting your vaccine, your boosters, is important to protecting your health and your well-being. You and I keep hearing people say that getting vaccinated doesn't really help because you can still get sick. We both understand that that's a gross misunderstanding of what's happening. But nonetheless, what would you say to somebody like that?
So the first thing I like to tell people is that what the COVID vaccine does do is that even if you got sick, what we like to call a breakthrough infection after getting vaccinated, what the vaccine is shown to do is protect you from severe illness. It protects you from being hospitalized, and it will protect you perhaps from even dying. And I think this is extremely important to keep in mind. I'm going to actually give you a little bit of personal medical history here, Greg. I've got my primary series, I got my booster, and 2 months after getting my booster, I got COVID-19. And I was really sick. But while I was really sick for 3 days, I was at home. I kept myself isolated, obviously, from family because I didn't want to infect them. But I came out of it. I did not end up being a statistic in the hospital because I'm of that age. I'm of the age where that illness would put me out for 3 to 4 days in a room flat on my back. I would have been a statistic in a hospital if I wasn't vaccinated. So I think what we want to remind ourselves is that while the vaccine may not be, and very few things are 100%, right? It may not be 100% at preventing you from actually catching COVID-19. If you got it, the vaccine will protect you from all those nasty things we talked about earlier, hospitalizations, long COVID, death. And I think that's what we want to keep reminding everybody.
Well, that's right, LJ. And thankfully, you didn't get hospitalized. You didn't end up on a ventilator. You didn't end up with a complication. You didn't die. And that's what's happening right now in the US to people who have not gotten vaccinated. This is now primarily a pandemic of hospitalization among people who haven't gotten vaccinated or who are under vaccinated. So this is very valuable information for people to know and to act upon. What's also important to mention here is that if you do get COVID-19, you can also get infected with another virus, such as influenza, and we call that co-infection. Getting one infection or getting sick and having your body be compromised can make it easy for you to get other infections and illnesses as well. So it really drives home the point that doing everything you can to help keep yourself and those around you protected is going to be key, because we do want to try to keep people from getting sick or sicker and from getting sick enough to require being hospitalized. You know, if you get that sick, first of all, it means you're pretty sick and your health is in danger. But secondly, as we're hearing around the US, there may not be enough hospital rooms or staff at your local hospital to take care of you properly in this very high infection time period. And then lastly, there are a lot of other viruses and even bacteria that are present in hospitals, and we try to keep people out of the hospital to protect them. So LJ, let's talk a bit about boosters, and maybe a good place to start would be explaining what a variant is and how that factors into the whole issue of boosters.
I think we're talking about variants is because the reason we have boosters is because we have the variant. So I think it's important to remind us of that as well. We know viruses have genes, and we know genes can mutate. And so a virus can reproduce very quickly. And every time a virus reproduces, that genetic code or the genes can change. And this can happen because there's some kind of random error in the virus as it's reproducing itself, or very often it's because the virus is adapting to the environment that it's in. And so what happens then is because of these mutations, we end up getting viruses that are very much like the original viruses, but are not exactly the same. And that's what we call the variant. So these mutations happen continually over time. These variants appear, they can disappear. The variants that allow the virus to survive better, those are the ones that are going to get pulled out, or what we like to call selected. And they're the ones that will survive and continue to propagate. And one of the things to keep in mind is that these variants will be different in terms of the symptoms, for example, that they cause when you compare them to the original virus. And sometimes these differences or these characteristics are what allow the variants to be fitter. In other words, able to survive better. And so a big factor as to why this Omicron variant is doing so well currently is because one of the characteristics it inherited is that it is far more contagious than its predecessor. And so that gives it an advantage. That's why it is surviving. And that's the reason why it's spreading so well right now. And so I think one of the things we want to keep in mind is that we've heard about subvariants now, and Omicron is a variant. And underneath the Omicron variant, we have all these subvariants. I've heard people call it the Greek alphabet soup, right? You know, the BQ, the alphas, the betas, they're all part of these Omicron subvariants that are popping up. And these subvariants pop up because within the Omicron variant, these subvariants, again, provide some kind of survival benefit to the virus, and it's experimenting. It's basically trying out which one works best. So that's why we have boosters, because when these variants pop up, not only are they sometimes more contagious, one of the other characteristics that allow them to survive is their ability to evade those immune system cells that I talked about earlier, that army that's inside your body that protects you. So if I can avoid that army, I have a much better chance of surviving. And so the variant that has a higher probability of avoiding those immune system cells is the variant that's going to persist. And that's why we need the booster. So when we have that happen, we have to design a vaccine that's now going to prime your immune system for the new variant so that we can now fight the new variant off better as well. And that's why those boosters are so important. And I think this is something that we just have to keep in mind. You know, the variants pop up. We need to create boosters to cover those variants. And that's one of the reasons why we have boosters. The other thing that we all know from previous vaccines is that not all vaccines will last a lifetime. You know, the duration of protection, what we like to call how long the vaccine protects you, will decrease over time. So similarly, we also know that with COVID-19 vaccines, the duration or how long it protects you will also decrease over time. And so getting the booster not only protects you against variants, but it also boosts that immune response in general, so that you're able to continue to fight off the virus as you get exposed to it. And certainly, Greg, as you've already pointed out, currently in the United States, people are getting exposed to COVID-19. If you are vaccinated, you're not going to get sick. If you happen to get a breakthrough infection, you're not going to die if you get that breakthrough infection, and you're going to reduce your chances of getting long COVID as well.
Yeah, exactly. While COVID-19 is a new disease for humans, and scientists are still learning about it and how it can impact us, we are seeing all the effects, including the long-term ones we've talked about, that it can have on your body. But, and this is important, we see a significant reduction in long COVID associated symptoms, complications, and people who get vaccinated and boosted. I don't think we can say that enough. And importantly, we're seeing that the vaccines for COVID reduce the risk, as we've talked about, of death, severe disease, and hospitalization. And as I mentioned, the majority of people who are dying of COVID at this point in the US are those who just ignore this message and are unvaccinated or under-vaccinated. And I think we have to acknowledge that there are many different variants that will continue to keep appearing. So getting your booster and keeping up with new boosters is important to keep your protection long lasting. Now, there are other ways you can also help protect yourself and others in addition to getting your vaccine and booster. This includes wearing a proper mask properly, not below your nose or below your chin. Stay at home if you're sick and follow quarantine or isolation recommendations. physical distancing from others when you're inside or in poorly ventilated places, washing your hands well and often with soap and water for at least 20 seconds, coughing or sneezing into your elbow and not your hand, and then getting tested for COVID-19 if you're having any symptoms or think you've been exposed. But again, getting your full vaccine series and your boosters is the key that will best protect you. Well, LJ, this has been a great discussion. Thank you for joining me today. Thank you for telling us a bit about your own history. I think that's helpful. Any closing thoughts or advice for our listeners?
Thank you, Greg. This is an important topic. And I think I'm just going to say vaccination is still the best way to reduce your risk of hospitalizations and severe COVID disease, including long COVID, as you've mentioned. It will decrease your risk of transmitting COVID to others, and it will reduce your chances of long COVID, as I said earlier. So again, why are we gambling? Why are you gambling if you're not vaccinated when there is a safe and effective vaccine out there? So I think that's probably the most important thing I can wrap up with saying. And thank you for having me here.
Yeah, thank you, LJ. And thanks to our listeners as well.